Hello there, everybody. This is Dr. Bob. Oh, technical difficulty. This is Dr. Bob Gabbay, the Chief Scientific Medical Officer for the American Diabetes Association, and I am here to answer your questions about diabetes. And your first question might be, what is with this jacket, Dr. Bob? It's different than what you usually wear. Your white coat has changed. Well, it has, and I'm wearing it for a reason. So this is Helping Children Month, and in honor of that, we're going to be talking about children and diabetes. And I recently had the opportunity to attend a really incredible event that brought together um, 1,000 kids with diabetes and their parents and loved ones. And one of the things I did there is I asked them to decorate my coat, my white coat. And so I'll give you just a little look here of what I have. You can see that they actually wrote Ask Dr. Bob on the back too. So this is perfect. So without further ado, I am going to start with the questions that we have. And I'll make one other mention. You know, I've been engaging more and more in social media, and so I now have a Twitter account, and it's at Dr. Bob Gabbay, so you can find me there. You can use the hashtag Ask Dr. Bob. And so we're going to talk about a bunch of things related to diabetes in kids, and I will get to a question that I know everybody has is, where are we around a cure? And I will talk about that in a few minutes. But first question is, why do kids get diabetes? And I'll talk both about type 1 and type 2. So type 1 diabetes, as a reminder, it's an autoimmune disease. Body's immune system attacks the cells of the body that make insulin and essentially destroys them so that no insulin is made eventually, and that's why people need to take insulin when they have type 1 diabetes, and that's including kids. And it is the most common form of diabetes in kids, but type 2 diabetes is on the rise. There are more and more more and more kids developing type 2 diabetes. So why do kids get that autoimmune reaction and trigger the development of type 1 diabetes? And the short answer is not very satisfying. We don't know. But there are some theories. So let me tell you what those theories are. We know that half of the risk of developing type 1 is related to genetics, but half of it is something environmental, and we don't know what that is. We think it might be some kind of virus, but we don't know which one. There have been a lot of different ones studied. We do know, and this is dispelling old, tales of it has nothing to do with the kids eating too much sugar. It has nothing to do with cow's milk. None of that is true. Um, but it probably is some viral trigger, and we don't know which virus and what. So that's sort of the story of, why kids develop diabetes. For kids with type 2 diabetes, um, it's really about obesity and becoming overweight and obese, and that puts them at risk for type 2 diabetes. So the next question is, what could be done to stop it, and to stop kids from developing diabetes? And again, let me talk about type 1. Um, if I was giving you the answer 2 or 3 years ago, I would say nothing really. We don't know what to do. And now there is some exciting new treatment that is being reviewed by the FDA and might be approved soon. So it is a drug called I'm going to say it slowly, teplizumab. Teplizumab. And what it's been shown to do is in kids and adults that are at risk for developing type 1 diabetes, because they already show that autoimmune reaction happening, This drug can delay the development or postpone the development of type 1 diabetes for sometimes years, and it's still unknown how long it will prevent, but we know it can delay as much as 2 or 3 years or more. So that's very exciting, and as I said, that's going to be the Food and Drug Administration is going to be looking at uh, potentially approving this in October, so not so far away. So that is the first treatment that could actually prevent the development of type 1 diabetes. And because of that, it's really exciting. And there is a big effort by the National Institute of Health to identify treatments, and they were the ones that helped find teplizumab as a therapy, and there are many others. And so, those of you that are interested in that area, um, there you'll find on the internet something called TrialNet, and TrialNet has lots of information about what's being studied and whether you want to volunteer to be part of studies to see what the risk of developing type 1 diabetes in children and also adults. For type 2 diabetes, what can we do to stop it? It's really about helping kids be more active and losing weight. And we have a wonderful program at the American Diabetes Association called Project Power. And I encourage you to look on our website, Project Power. You can enroll free, really great resource. Okay, so that's what can be done to stop it. Hope for a new treatment. What kind of care do I need for my child? And you know, things vary, but I'll give you some basic principles. Um, you really need a team. And what do I mean by that? It's not just one person that's going to help uh, you and your child manage their diabetes. Certainly, a doctor is key, um, but it's going to be other people. It could be dietitians and diabetes educators as important people, nurses. And here's one that I want to put a big plug in, and that is mental health and behavioral health. So there's a lot to adjust to when a child develops type 1 diabetes for the child, for the parents, and really for the whole family because it changes things for the family. And that's why talking to professionals that can help guide the family on how to do this, I really, really recommend seeking that out. So the answer to what kind of care do I need? You need a team. You need a physician, pediatrician, certainly, pediatric endocrinologist, ideally. In other words, a pediatric specialist in diabetes, but also other members of the team, including mental health, behavioral health. Okay. Next question. Can children with type 1 diabetes still play sports and participate in typical, kids' activities? Let me be very clear on this. Absolutely, yes. Absolutely. We do not want the message to go out to kids with diabetes that they can't do all the fun stuff that they want to do. They just have to take some extra precautions. And a lot of that is around depending on their age, and or their parents or caretakers to be following blood glucose levels. And this is where continuous glucose monitors have made such a big difference to be able to measure glucose continuously, and their loved ones can actually, parents can be looking at the data in real time and seeing what their blood glucose levels are. So, really highly recommend a continuous glucose monitor. It's not without some adjustment like any new treatment, and that's again where your care team can help. So, what resources does the ADA provide for people with type 1 diabetes? Well, a lot. So, first, I'll talk a little bit around for the parents, and then it applies to kids as they get older and able to read all this information and take it in. There's lots of information on the American Diabetes Association website, diabetes.org. Um, and one of the challenges that unfortunately many people have to deal with is the cost of insulin. And so we have a website to help you on that. And it's Insulin Help, all one word, .org. So that's another great resource for you to use. Um, and I mentioned for type 2 diabetes, Project Power is a great way about preventing diabetes, and there are other resources there. Um, and then the question is, what about for the kids themselves? What do we have? And right now, there are these amazing camps that are going on around the country. We have thousands of kids in these camps scattered around the country. If you go to the diabetes.org, the American Diabetes Association website, it'll tell you about camp. These are sleepaway camps for sometimes a few days, sometimes a week, and they really are life changing. Kids get to play and connect with other kids with diabetes and understand they're not alone. Um, they learn about diabetes in a fun way. They learn to adjust to activity and all the things that one needs to do. They're really wonderful, and there's still time to sign up. So go to the website and learn more. So again, for those that you're joining late, this is Ask Dr. Bob. This is Making a Difference in Children Month, and we are talking about children and diabetes. And the question that I get the most often is, and then again, the kids that decorated this lab coat, were asking the same thing as their parents were, as what's happening around a cure. And so let me give you the latest update, because last month we brought together thousands of researchers and clinicians from around the world to share the latest research around cure and everything else related to diabetes. And so this is hot off the presses. So I'll start by saying I think a cure comes in two forms. Um, you know, One is what you might have heard of, the bionic pancreas, and it is some way of automating insulin delivery. It's not quite a cure, so some people wouldn't count it. But let me just tell you, it is taking that continuous glucose monitor and using those glucose data to tell the insulin pump how much insulin to give. And those already exist and they work. Um, but they don't do everything. They're not good at making adjustments for meals. And that's where still one needs to think about what are the kids eating, how many grams of carbohydrate it is, and dosing the right amount of insulin. But it's a step towards a cure. But what about a real cure? Well, this is really about replacing those cells. I mentioned the type 1 diabetes is caused by the destruction of the cells that produce insulin. So, can you put those cells back into people? Yes, you can. And we've been able to do that for some time. The problem is the supply of those cells. So people can donate their pancreas and one can isolate those insulin producing cells and put them into kids, and that works. But there's just not enough of those donated pancreases. So what has happened since is, and this is, something we would have thought science fiction a few years ago. We can now take a blood cell and and sort of make it go backwards to become a stem cell. So if you think about, you know, life starts with, an egg and a sperm cell merging together to form a one cell organism that then is a stem cell, meaning that it can turn into anything and everything. Well, essentially, those blood cells can be coaxed to go back to that early cell that can be anything, And then that early cell can be grown into a beta cell, into the specific kind of cell that produces insulin. And they've been successful in doing that already. And that was a huge step forward that's just happened over the last, probably 3 to 5 years. Now, trials are going on putting those cells into people and seeing if it works. It works in animals. And that has, again, at our big scientific meeting last month, one of the attempts by a company called Vertex, uh, they shared data where this was put into two different individuals very early on. And one of them stopped using insulin altogether. The other had much better blood glucose control, but and needed less insulin, but not off insulin altogether. So we're not so far away. Now, let me give you a couple of caveats. We have an unlimited supply of these cells, in theory, and we can put them into people, into kids. Um, but we still have to shut off the immune system in some way, and that's the next step. Can you get around that? And there are a couple approaches. One is to put these beta cells into a little microscopic cage that allows them to be protected from the immune system, and so there are efforts there. Uh, or can you take those insulin producing cells that you've made in the laboratory and tweak them so that they don't get destroyed? And that's another attempt. So we're not there yet, but we are getting closer, and I think there's a lot of hope, and that's work that the American Diabetes Association, along with scientists around the world, are working at. So, um, if you're enjoying this program, please tell your friends. This is Ask Dr. Bob. You can follow us on Twitter at Dr. Bob Gabay or hashtag Ask Dr. Bob. And I, I really think we're on the cusp of some very exciting things for kids with diabetes. And the things I really want you to remember is that you want a team to help you manage and do well, and that children should be able to do anything they want to do just with a little extra care and guidance. This should not mean that they can't do the things they want. And think about camp. So, thank you all, everyone, and we will see you next month for another episode of Ask Dr. Bob. Thanks, everyone.